The Butler Radio Network now presents The Daily Focus. The program can be heard live each weekday on WISR 680 AM and 107.5 FM. It can also be heard on WISR680.com. Like and subscribe to The Daily Focus wherever you listen to your podcast. The Daily Focus is presented by Cunningham Shaner, a name you know, service you trust. Now, here's your host, Tyler Friel.
Welcome to the program, listeners. Tyler Friel with you on WISR 680 AM, 107.5 FM. This is the Daily Focus, and we're brought to you by Cunningham Shaner, a name you know and service you can trust. Well, earlier this week, there was a tragic news story in Butler where 3 people died of suspected carbon monoxide poisoning. 2 people were hospitalized from this incident as well. So what we thought we would do today here on the program is just to talk about carbon monoxide overall, because I think some people, you hear about it, but there's a lot of unknowns that are out there, and so we want to learn a little bit more about that. So today, joining us on behalf of the Independence Health System is Dr. Shrishrimal, who joins us by telephone. Dr. Shri, we appreciate you making the time, and welcome to the program.
Thank you so much, and good morning to everybody.
So we'll just start with this. This will be, I guess, a scientific question. What is carbon monoxide poisoning? What do we know about it?
So carbon monoxide is an odorless, tasteless gas which is, resulted from an incomplete combustion of hydrocarbons. And there are multiple sources of exposure, and that's something which is important for us to know. Smoke inhalation from fires is there, and then there is poorly functioning heating systems. So this is essential and important during the winter season, especially the Northeast, where it gets really cold. And then there is improperly vented fuel burning devices like kerosene heaters, charcoal grills, camping stoves, gasoline-powered electrical generators. Then there is one other source is motor vehicles operating in poorly ventilated areas like closed garages, parking garages, warehouses. Sometimes keyless cars just left running, or even like tailpipe blocked by snowdrift. So these are some of the sources of carbon monoxide. And the incidence of carbon monoxide poisoning, of course, ranging from mild to severe, is about 50,000 people in the United States. The mortality, however, is about 1 to 3%. So we're talking about, 1,000 people, dying of carbon monoxide poisoning in the United States. This is a little brief about what carbon monoxide poisoning is about.
So as you take a look at this, and you mentioned tasteless and odorless, and to me that seems to be a big key point here, because in a lot of instances when you hear about stories like maybe we heard about earlier this week, is that a lot of these folks who fall victim to carbon monoxide poisoning weren't necessarily aware of that. Is that kind of the case with some of these tragic stories?
That can happen because the initial symptoms, when it's in the milder form, may actually mimic just like a flu-like symptom. So people initially may just have headache, nausea, dizziness, drowsiness. These are some of the initial symptoms. And sometimes, and as it progresses, it may, people may have vomiting, shortness of breath, coughing, choking. The key to this is when multiple household members, including pets, start having symptoms similar to this, may mimic like a cold or a flu-like symptoms. I think that's the time when you need to kind of, take attention and either get checked out or have somebody come and check out the household. And I'm assuming most of these houses should have carbon monoxide detectors, and I'd definitely like to, spend, some time, alluding to the ways we could prevent this. But yes, the initial symptoms may just mimic any flu-like symptoms. The problem is if we don't pay attention to the initial symptoms, and as it progresses and it gets worse, then we lead to very major symptoms and complications. Because the way carbon monoxide works is it has strong affinity to hemoglobin and not so much to the oxygen. So it basically impairs your oxygen delivery and can cause impaired oxygen utilization. And it also releases some reactive oxygen radicals causing inflammation involving the brain and stuff. So once it gets more severe, then it can cause end organ injury. Like some people may just pass out, some may have seizures, feeling of transient loss of consciousness, and people can even go into coma. Some other adverse complications when it gets more severe, it can cause myocardial injury. So people can have, myocardial infarctions, you can have arrhythmias, you can go into pulmonary edema, it can cause severe acid-base balance. Now, when it gets to that point, that is considered very severe carbon monoxide poisoning.
So whenever you talk about that initial onset of symptoms, which you described a little bit like the flu-like symptoms, and I know we've been talking on the news about the uptick in flu cases here, so a lot of people may hear that, may think they have the flu. You talked about worsening symptoms. What are some of the key notes, and I know you alluded to it, but I kind of want to hammer down here. What are some of the key symptoms that somebody may feel going from, I feel like I've got the flu, to, hey, this got a lot worse?
Yeah, so once you start, people feeling more drowsy, dizzy, along with these flu-like symptoms, that's the time you got to, go and get some more attention and get checked out. Usually when, typically during this time of the year, people have this runny nose, a little bit of feeling feverish, and that's sinus congestion. And that's okay. But once it starts getting more severe, and especially if more than one person in the family is having these symptoms, and then people start having feeling of drowsiness, dizziness, and if there's even any one person who has lost consciousness or transiently, even for a few seconds, or feeling more short of breath, having some chest discomfort, those are very serious symptoms where, you need to call 911 or even fire department and, kind of get checked out.
Joined by Dr. Shrishrimal. We're talking about carbon monoxide poisoning here on the program. So let's talk about prevention tips. What are some of the things that people can do, homeowners can do, to make sure that they're ahead of the game whenever it comes to carbon monoxide poisoning?
Absolutely. I think preventing carbon monoxide, involves proper equipment maintenance, safe practices, and of course monitoring. The first step, I think, is to install carbon monoxide detectors with alarms. I'm not sure what the latest codes are, but I think, homes built after certain years have to have. But if they're older homes, definitely recommend installing battery-operated, carbon monoxide detectors. Make sure you test them, monthly and replace batteries as needed. And I think they need replaced every so often, like every 5 to 7 years or so. But installing carbon monoxide detectors with alarm is essential. Then, of course, proper ventilation. We have to make sure we ensure adequate ventilation when you're using fuel-burning appliances or heaters. You never want to block or seal the vents, chimneys, or exhaust systems. That's key. And of course, maintaining your appliances, appropriately, regularly inspecting and maintaining your furnaces, water heaters, stoves, and, of course, hire qualified technicians who can service these, on an annual basis every 6 months or so. That, that definitely will help minimize some of these. And of course, safe usage of equipment. You don't want to use equipment like generators, charcoal grills, gasoline power tools in an enclosed, spaces or indoors. And of course, one of the things which carbon monoxide can have intentional uses sometimes, where where people run their vehicles inside garages, and you don't want to kind of do that, and even with the door open. So that's key, is you want to make check on your vehicles, because sometimes a lot of these cars these days have keyless kind of starters and stuff, and sometimes we forget because they're so quiet. You don't realize you shut the engine off or not. So it's very essential to make sure you do not run these vehicles inside garages. And as we had alluded before, educating the household members, that's very essential about, what are the symptoms, again, like headache, dizziness, nausea, confusion. If anybody's having these symptoms, definitely especially during this time of the year, you want to pay attention to those symptoms. And of course, people who have chimneys and fireplaces, you want to make sure they're clean, they're free of obstructions, and of course, use only properly vented fireplaces. The portable generators, I think they should be outdoors, at least 20 feet from windows, doors, and vents. And lastly, use certified products, and I think, all these preventive points will definitely minimize carbon monoxide poisoning. The only way to detect this is, of course, you have symptoms, but the only definitive way is, checking carboxyhemoglobin levels in your blood, through either venous blood or arterial blood gas sample. And when your level is, above a certain range, that would indicate that, yes, this is carbon monoxide poisoning. It's different in smokers, versus non-smokers. And then depending on the severity of the symptoms, then patients are treated accordingly. The treatment usually involves high flow oxygen, and if they really, have severe complications or symptoms, then they may end up needing hyperbaric oxygen.
Dr. Shrishrimal, again, of the Independence Health System, helping us understand carbon monoxide poisoning and ways to prevent it along with symptoms. Dr. Sri, we appreciate you making the time and appreciate the insight here to a very relevant topic this time of year.